Welcome to our and OSCE learning sessions. Today we will go through Station 3, Specific Physiological Assessment and Overview. As always, begin by carefully reading the scenario for 2 minutes to understand the patient's current condition and the recommended actions. Once you are clear on the task, proceed without delay and with confidence to carry out what is required. Ensure scene safety and patient privacy. Then start by introducing yourself and explaining the purpose of your visit, such as I'm here to check your orientation, assess your level of consciousness using the Glasgow coma scale, and evaluate your muscle power. In the physiological assessment station, the initial focus was on pain assessment, but it has now shifted to neurological assessment. Be aware that this situation may change again to other systems like cardiac, gastrointestinal assessment, or respiratory assessment as well. If the patient is oriented to time, place, and person, simply tick the appropriate boxes. How you will identify whether the patient is oriented to time? Ask questions like this: can you tell me what month it is, or what date is today? Avoid asking for the exact time, even when normal individuals may struggle. Place orientation. Ask, where are you now, or where are you from? And about this person orientation, ask, do you know who am I, or who is this? If they identify you as a nurse or recognize others appropriately, mark it. Usually, patients will look at you and initiate conversation during your introduction, which gives clues to their orientation level. While entering the room, on the table, you will find a folder containing the observation chart. Check it carefully for the specific instructions which provided. These may require you to mark the score, place a dot, or tick the appropriate boxes. Begin by marking the orientation session first. Then proceed to record the Glasgow coma score, followed by the muscle power grading. With regards to this Glasgow coma scale, you don't need to memorize every point, but understand the scoring and how to assess it. Let's start. You just assess the spontaneous eye opening when you enter the room. If it's so, you can score 4 marks. And if the eyes open only to verbal cues like calling their name, you can score it 3. And the patient opens the eyes only to the pain stimuli, like if you are giving a glabellar tap. If you are giving the glabellar tap or orbital pressure, then only if the patient opens her eye, then give it 2. And if for no eye opening response, you can score as 1 point. Observe their natural behavioral first. Observe their natural behavior first. If eyes are closed, try calling their name. If there is no response, apply mild pain stimulus as directed. Always refer to the instructions sheet carefully. It will indicate to you whether you should tick, dot, or write the scores. And moving further, you have to check the verbal response by giving appropriate correct answers. Like if you are asking about their name, whether they give appropriate answers, then you can give 5 score. But the patient is confused but able to speak in full sentence, you can give 4 score. If it is an inappropriate words or short phrases without clear meaning, then you can give 3 scores. And if you noticed the patient makes only sounds or like morning sounds, no recognizable words, then you can give 2 score. And if the patient doesn't make any sense, like no verbal response at all, you can give 1 score. So always score from the highest to the lowest based on the worst verbal response you observe. While assessing the motor response, ensure the patient does not have a physical disability that affect their movements. For example, if the patient is having hemiplegia, like which side is got affected, you can ask that, can you raise your other hand, or can you raise your left hand or right hand, Or if the patient has paralysis, the four limbs are paralyzed, instead of giving this command, you can give an alternative command like blink your eyes, open your mouth, and show your tongue. So if the patient is doing so, definitely you can give 6 score. And if the patient localizes the pain, like pushes the stimuli away, pain stimuli away, you can give 5 score. And when he withdraws from the pain, you can give 4 score. And any kind of abnormal flexion, that is decorticate posture, as you all know what is abnormal flexion, in that if the patient may exhibit that symptoms, you can give 3 score. Any kind of abnormal extension, the patient is already lying down in that abnormal extension position, you can give 2 score. If there is no motor response, definitely you can give 1 score. If you are giving any kind of pain, like a pain stimuli, always try to use a sternal rub, not nail but pressure, for pain stimulus, as some patient may have some kind of sensory defects. This minimum GCS score is always 1 for each component. A fully conscious patient, like spontaneous eye opening, oriented, obeys command, then you can give the score of 15. If any confusion or the patient is not obeying commands, so accordingly you can mark the score. That's all about Glasgow coma scale. Let's see how to perform this muscle power scaling or muscle power grading. Here, a scale from 0 to 5 to check how strong your muscles are. This is done for both arms and legs. Muscle power grading is a method used by healthcare professionals to measure how strong your muscles are. It helps to identify if there is any weakness, paralysis, or any change in the muscle function. This grading is done on a scale from 0 to 5 This grading is done on the scale from 0 to 5, with 5 being normal strength and 0 meaning no muscle movement at all. Okay, this test is usually done for both arms and legs as well. See, if you noticed no movement at all or no visible or only felt muscle activity, you can give 0 score. The muscle tries to contract, but there is no real movement, that we called as flicker or trace of contraction. For that case, we can give 1 score. When the patient can move only when the gravity is removed, for example, sliding the arm or leg on the table but not lifting it. He or she can slide the arm or leg on a table but not lifting it. Then you can give 2 score. You can lift the limb but cannot resist any pressure. That means move against gravity only. I repeat, the person can lift the limb but cannot resist any pressure. Then you can give 3 score. Or if you noticed he or she can move fully against gravity but resist only moderate pressure, then you can give 4 score. That means slight weakness is present. And he or she can move the muscle fully against gravity and also resist strong pressure as well. You can give 5 score. That is a normal strength. So this is a method used to assess, to measure how stronger your muscle are. It helps to identify if there is any weakness, paralysis, or any change in the muscle function. You will be given by a muscle power grading format like this way. Both arms and legs you should assess individually, and you can score whether your patient is having full range or whether the patient is having the full range of motion only against gravity, or you can notice a visible or palpable contraction, or the patient is not at all responding, or no visible or palpable contraction. That also you can assess. This will provide an accurate information about how well or how strong your patient's muscle are. This is done for both arms and legs. That's all about Station 3. In this station, you need to complete 3 levels of task accurately while managing your time efficiently. Aim to practice and finish within a 6-minute time frame. Be prepared for multiple questions related to the station, such as what is this assessment for? How often will you perform it? What is my score and what does it indicate? Make sure you can confidently answer these questions while performing this task and ready to manage any situation.